Hi, Emma. I'm Lindsay, a student physical therapist. Is it okay if I work with you today?
Sure.
Great. So what we're going to be doing is I'm going to help you stand up in the parallel bars. We're going to do a marching activity, and then we're going to ambulate a few steps. Sound good? Great. Okay, so first thing I'm going to have you do is you can use the armrest. You're going to scoot forward a little bit for me. Great. I'm just going to help you stretch your legs a little bit. Okay. Okay, and you can push off using your arms and do a little bit of nose over toes. Okay. Stand up. Good, and reach for the parallel bars. Good. How do you feel?
Feel good.
Good. Okay. So next thing I'm going to have you do, I'm going to help you weight shift this way, and I just want you to lift your knees slightly. Great. Good. And again. And I would probably have her do 3 sets of 10 on each lower extremity. And for progression, I can make it like reciprocal. Good. Okay. We're going to switch. We're going to weight shift this way and lift that leg. Good. And you feel okay? Great. Very nice. Okay. And the next thing, we're going to take a few steps forward, okay? And I want you to think about that weight shift as you go to lift the leg. I'm going to help it the back of your legs at our hamstrings. Okay. Go ahead. Very nice. My patient for this case is an 18-year-old female who has a T6 vertebral fracture and now has an incomplete injury at that spinal level. Still has muscle grades 3 at L2, L3, and L4, but 0 at L5 and S1, and I'm assuming everywhere below, and then has intact sensation at T6 with some light touch at T7. So for my session, I had her scoot completely independently because she's got the upper extremity function. I did min assistance for the sit-to-stand transfer because that is what was provided for the squat pivot that was in her chart. And then in the parallel bars, I did a marching activity and an ambulation activity. So for the marching, I tried to facilitate weight shifting to like practice the weight shift in normal gait and also to work on her hip flexor strength by having her actively contract. And then for the ambulation activity, I facilitated at the hamstring because usually we think hamstring like S2, and if she's got a 0 muscle grade at L5 and S1, I assume that she has no hamstring strength. And by facilitating at the hamstring, I allow her to focus on the weight shift and also like normal hip flexion without having to worry about toe drag. If she was having issues with buckling, I could have easily, after I facilitated the hamstring, also use my opposing hand to stop right below the knee. But in this case, Emma had no signs of knee buckling, but of course I would have to look at the patient. And something important for this case is I would have her in an AFO with a plantar flexion stop because she's got muscle grade of 0 at the plantar flexors.
RG is a 69-year-old male who suffered a spinal cord injury and underwent C4-C7 surgical stabilization. Patient is now in an inpatient rehab setting and presents as a C5 ASIA. Patient requires mat to max assist in all bed mobility, max assist to manage the lower extremity, and a slide board for transfers. RG should have maintained tenodesis grip throughout the treatment session. Patient also presents with extensor tone in bilateral quads and plantar flexors, as well as clonus in both ankles. Balance interventions can be incorporated in short sit position, and upper extremity strength can be practiced in supine.
Hi Lindsay, my name is Emma. I'm a student physical therapist. Can I work with you today?
Of course.
So we're going to practice going from your wheelchair to the bed. And the first thing we're going to do is slide forward in your wheelchair. So if you could hook one arm, good. We're going to switch forward, nice. Now we're going to do the other side. Forward, great. And you can come back to the center. Now we're going to hook around the arms of the wheelchair. So I'm going to stick this under for a transfer. Great, you can come back. So to do this, you're going to wrap your arms around my arm and lean forward. We're going to do our head-hip relationship to gain momentum to move this way. Let's get started. So you're going to wrap your arms around here. Good. And we're going to go 1, 2, 3. Good. Again. 1, 2, 3. Good. All right, one more. 1, 2, 3. Good. You can release. How do you feel? Good. Do you feel balanced?
Yeah.
Okay. Now we're going to lay flat on our backs. I want you to come down to this elbow. So forward. Good. And then we're going to use this arm to scoop our legs up. Good. Good. slowly lower. How do you feel? I'm just gonna adjust you a little bit so you're straight. Are you okay? Now we're gonna come back onto your elbows into the sitting position. So I'm gonna weight shift you from side to side. When we weight shift this way, you're gonna lift this elbow up first, okay? Trying to go this way, good. Now this way, good. All right, now we're gonna come up onto our hands. So we're gonna do a big throw behind you. We're gonna go this way first, throw, good. And we're gonna go back this way, big throw, good. So now we're gonna get our legs back to the ground. You can take this arm, we're gonna scoop under this leg, and scooch it down, good. I'm gonna help you with the other one, okay? Good.